Hi, everyone, and welcome to episode 1 of season 2 of Medicine in Motion podcast, where we talk about movement as medicine. From prevention and management in health and disease, physical activity plays a significant role. This season, we are focusing on physical activity in the context of the COVID-19 pandemic, and we'll be exploring a range of topics that will address the what, how, and why of keeping physically active during these times.
My name is Swapna.
And I'm Mackenzie.
And we're MD, PhD, and PhD candidates from the University of Toronto. And in this episode, we explore the topic of the importance of exercise on the body's physiology during the pandemic. We'll touch on particular pre-existing conditions, and we'll chat about exercising in this new context of public health measures.
In today's episode, we'll be discussing the importance of exercise from a physiological perspective, which is a fancy way of looking into the effect of exercise on the body when it is challenged with such an infection. And we will explore this by discussing exercise before infection, and we'll call this prehabilitative or prehabilitation, during infection, and after infection, which we'll call rehabilitation.
We are very excited to host our two esteemed guests today, who are both physicians at Cleveland Clinic in the USA, specializing in heart health, and they've published articles on the importance of exercise during the pandemic. And if you have any questions along the way, please either post them in the forum or in the comments so that we can share them in the audience question and answer period.
Please join us in welcoming Drs. Singh and Michael Emery. So we'll start off with kind of an overview of the pandemic and also of COVID-19. So how has the pandemic affected your areas over the past few weeks, and how are you both staying active during these times?
So I can start. I think, as you guys know, the pandemic's kind of had, significant waves initially from the onset in January, February, March, and then with the lockdown, we really saw numbers going down. But I think once we've kind of opened things up, the numbers have definitely risen. And last I heard this morning, we hit the 250,000 death mark with regard to the pandemic, which is quite impressive. So I think activity is a huge part, at least in my life. And when the gym shut down, I think for me, it was a bit chaotic. I tend to rely on exercise for kind of my mental well-being. And it's a huge way for me to just kind of stay grounded and stress-free. And so there was a little bit of panic, but I've been able to find my way. I love to run and bike. So I ended up just kind of buying a treadmill, running more outside, and I've been able to stay active, doing a lot of virtual races, and actually just ran a virtual marathon 2 weeks ago, which went really well. So I'm finding the way to do it. And I think, I encourage my patients to do that as well. So there's definitely ways to stay active, being mindful really about your activity during the pandemic.
It's been an interesting time, particularly in the fitness industry, in the gym industry, I think, because of the pandemic and the lockdowns and the effects it's had on its business. My personal passion for my own outlet is CrossFit, which is very gym-based and very community-based. So the CrossFit community got hit hard, especially with the closure of gyms, because it really eliminated that big fundamental piece of CrossFit, which is the community. The fitness part of it, we made do with some home dumbbells for several months until gyms started reopening. So I've been back at the gym now for several months, which has been an interesting paradigm shift in extra cleaning, mask wearing, exercising with masks, and making sure there's some social distancing in a CrossFit style class.
Mm-hmm. And that's a really good point about the mental wellness aspect of physical activity and how that does continue to be a really important part of all of our lives. But I think both of you sound like you've made the most of these challenging times with the virtual marathons and using the public health measures and to ensure that you can engage in physical activity as safely as possible. So now we're going to switch gears a little bit and ask both of you to give us a brief overview of, say, the pathophysiology of how the COVID-19 virus attacks the body, because we used to think that COVID-19 was strictly a pulmonary disease earlier on, but now we have more evidence that shows it affects much more, with the incidence of heart attacks and stroke and even mental health impacts following the infection. So could you both please comment a little bit on the idea that COVID-19 is a heart and vascular disease and potentially even more?
So I wouldn't say, I agree with you. It's a multisystemic disease. I mean, it's one of those SARS coronaviruses that enters the body. You have viral replication, and I won't pretend to be an infectious disease specialist to really comment full throttle on the pathophysiology, but basically it breaks down the kind of endoepithelial borders, those barriers, and can really infiltrate cells. And with regards to which systems are compromised, kind of the most devastatingly, we've definitely seen more pulmonary complications. But, if you think about it, we've seen pulmonary complications, cardiovascular complications, vascular complications with venous thrombi, arterial thrombi, kidney damage, kidney failure. So really, it's very multisystemic. So I really would not necessarily call it cardiovascular in nature or primarily cardiovascular. I think with respect to how it affects our heart, with any specific virus, viruses can invade our myocardial walls themselves and cause myocarditis. And that's probably the most kind of common thing, or the first thing that comes to our head when we think about cardiovascular complications. But with really any virus, any sort of sepsis picture, you can also have kind of the, very common things like MIs and like underlying cardiomyopathy getting worse, or even, going into kind of an acute cardiomyopathy or acute quote unquote heart failure picture. So there's so many things with regards to the cardiovascular spectrum. It's hard to say that this is just truly cardiac in nature. I think you have to respect the disease and understand that it's going to really affect all systems, pulmonary really being one of the more commonly devastating consequences.
Yeah, it's an interesting disease that is still mystifying a lot of us in the medical community, and partly because it seems to be this beyond just a standard virus that we're used to affecting all these different organ systems. It's still definitely primarily a pulmonary disease, but we've definitely noticed an increased incidence of cardiovascular involvement, particularly this virus, maybe than other viruses we've seen in the past. And neurological involvement, which, we're definitely not neurologists, but we do hear a lot about neurological sequelae and involvement in this disorder. It's a bit controversial still as to the pathophysiological mechanism of what's causing a lot of this from a cardiac standpoint, whether that's direct invasion of the myocardium by the virus and reproduction of the virus, or replication of the virus and a classic, quote, myocarditis picture. Some of the autopsy studies are showing the virus in the myocardium, but aren't showing the classic pathophysiological autopsy findings of myocarditis. But some are. Imaging studies are a little bit harder to interpret, whether it's myocardial inflammation or we're just seeing the sequelae of whatever is happening, the microthrombi. We're seeing a lot more venous thromboembolisms in this disorder as well. So it's a really kind of a mysterious disease as we still are trying to unravel how it works. And it will probably be years before we completely understand what is all happening to us now that have gotten the virus.
Mm-hmm, mm-hmm. And I guess just to dive into this just a little bit more, the entry of this virus into our cells is through this receptor called the angiotensin II receptor, which I believe is on all of our nucleated cells. And so although it's easy for infection in our lungs, I think that's why it also spreads to many of the other tissues, is because this receptor, which the virus kind of attacks and then can enter a cell through, is pretty widespread throughout the body, as I believe. Is that correct?
Yeah, that's correct. The ACE2 receptor is a widespread. It's expressed variably in different tissues, but it's pretty much in every tissue. Part of the rationale then and the concern was people that were on angiotensin receptor inhibitors for hypertension may have been at higher risk for complications from the disease. And there was a big scare about that in the very early stages of the disease, that maybe you shouldn't be taking that medication. But it turns out when we looked at studies that didn't seem to portend a worse diagnosis to take an ACE inhibitor in and of itself, but having hypertension is a risk factor for more complications to this disease.
Mm-hmm, mm-hmm. Okay. And then is there understanding of kind of the immune response also growing a little bit? Just because we used to think that, oh, this is kind of just a pulmonary disease, but now we're seeing that for young people, there might be a little bit more activation of the immune system.
Yeah, I think so. Mike may be able to speak more on this. I'm not as familiar with regards to how much we know about the immunocompromised with respect to our younger individuals. But, at least within our population here, we've definitely seen people within their kind of teenage, 20s, early 30s be impacted pretty significantly. So Mike actually, may be able to speak to that some more than I can.
Yeah, the overall consensus that I keep hearing and talking to people about is it doesn't seem to affect children and pediatric patients as significantly, at least in terms of the overall prevalence of people getting the disease and having major complications and hospitalizations. There's definitely, kids that have complications from it. Obviously, if you're immunocompromised, you're always going to have more potential for adverse outcomes from a viral infection. The thing that they're seeing a little bit more in the pediatric population is this inflammatory syndrome that may look a little bit like what's called Kawasaki's disease. So it's a multi-system inflammatory response. I still don't think it's all that common, but it has been seen. They think that's more immune mediated, but it's not something that we as adults and adult cardiologists like Dr. Singh and I really see in an adult population.
Mm-hmm. And you mentioned hypertension just previously, and I'm curious if there are other comorbidities or perhaps comorbidities that we can say are riskier than others for folks who are having COVID-19.
At least from the preliminary studies, people with heart attacks who've had stroke history, diabetes, hypertension, kind of those typical risk factors that we expect to see in people who really have kind of increased risk for any other comorbidity are those who are at greater risk for COVID. But, I think we've kind of touched on the fact that, at least in my mind, we still cannot identify, the specific risk in each individual. Even the healthiest of the healthiest are getting pretty significant symptoms and requiring hospitalization and may even, become severely hypoxic and require, ventilator therapy, right? So I think there's such a black box about this virus that once we can actually articulate who really is at risk, irrespective of comorbidities, irrespective of how healthy you were to begin, and then we'll actually really be able to do something about it and have some sort of algorithm in place for predictive modeling, I should say. But I think that's really the big challenge here. You just don't know who's going to be the one who's going to get hospitalized or have some devastating consequence.
And that goes to the difficulty in applying large population studies to the individual that you're sitting next to, right? Because in a big population study, it says that, if you're obese, elderly, hypertension, diabetes, you have higher risk for complications. But we've all seen people in that group that do fine and have minimal symptoms. And then we see individuals with no risk factors that are in the ICUs ventilated and succumb to this. So there's always that missing piece that we never totally understand in these population-based studies. And taking a population-based study and always applying it, like Dr. Singh and I have to do on an individual patient sitting in front of us in the clinic, it can be more difficult.
Mm-hmm. Mm-hmm.
And I suppose that really does shed light on the fact that we are still learning so much about this virus and a lot are still unknowns.
Mm-hmm.
Yeah, there's a lot of unknowns still with this.
Yeah.
Do we happen to know of any protective mechanisms that exercise might afford an individual before infection? So, for example, is it cardioprotective? Does it help to mobilize and make the immune system a little bit more robust?
Yeah, exercise is fantastic, right? It's going to be increasing your blood flow, your circulation of, it's just your immune cells in itself. So I think from a cardioprotective or overall multi-systemic protective nature, exercise is fantastic. Like we just alluded to, it's not necessarily going to protect everybody, right? Because we don't know what other risks or what other entities are predisposing certain individuals to have more devastating disease. But I would, at least in my mind, say, exercise, apart from the extremes of exercise that can provoke more of an inflammatory response and compromise you a little bit, can really only help you. And being smart about how you do it, particularly in the pandemic, making sure that you're not really in contact with people, socially distancing, masking up if you can. I think all of those factors are really going to play a role. But yeah, reduces, if you think about from a cardiac perspective, it reduces your blood pressure. Like I said, it improves oxygenation. So, you're getting better ventilation and circulation in itself. So I would say still go out there and exercise if you can.
Yeah, there's this entire fascinating field called exercise immunology that I find personally fascinating. It's not something I necessarily practice on a day-to-day basis, but it's interesting when I've delved into it in the past. And in general, the exercise immunology little niche field suggests, and it's pretty well accepted, that exercise, at least moderate exercise, sort of that regular exercise, boosts your immune function and may actually help protect you from getting sick or as sick. Nothing makes you completely immune to anything, exercise alone, but there's a general consensus that exercise would boost your immune function and would lower your risk in and of itself. The flip side of that could be, though, how and in what environment you exercise. So if you're, exercising by yourself in open spaces, you're getting the exercise benefit and you're not having that closed environment. But now as we get into winter and more gym-based needing to exercise inside, then the risk of exercise isn't the exercise itself, it's being in close proximity to other people who are breathing heavily and spreading these respiratory droplets in close isolation to you in places that aren't as well ventilated.
Mm-hmm. And can we say that there might be certain types of exercise that might be better from a prehabilitative perspective, or is it not possible to make that kind of a general statement and it's more specific to the specific individual when we're talking about, say, aerobic training or strength training?
I think they're very complementary to one another. So I don't think one is better than the other at all. I typically advocate for people to get some good aerobic, whether it be high intensity interval training or whether it be kind of those long, sustainable endurance type of exercises. I think both, again, really improve your circulatory flow, improve your oxygenation, keep your immune system strong, keep you mobile and keep you flexible and whatnot. But strength training is also really necessary to support all those functions. With weightlifting, with the CrossFit, with the powerlifting, even with just 5-pound dumbbells, you're still going to improve blood flow and oxygenation. But I do think they're very complementary.
Yeah, I totally agree with that. You gotta get out and move. And from my standpoint, it's getting out and moving and being active is the key. And however you do it, as long as you're happy and enjoy it and not injuring yourself because you're being silly and getting your ego in the way, then it's probably of benefit to you.
Right. And it sounds like variety would be part of your exercise prescription for folks that you might talk to.
Especially now, because I think everybody's got to be a bit creative to stay safe and exercise safely.
Yeah, I think just variety helps in general. A lot of our patients, unfortunately, only can think of one thing, which is go for a run or go for a bike. And, the variety is what probably keeps a lot of people active because it gets them from being bored.
Right. Yeah. I'm curious as to maybe what ideas you might have for patients who might be a little bit stuck in terms of the creativity aspect and how to get active during the pandemic. So do you have some ideas?
So I always start by saying your heart really doesn't care what you're doing, right? It doesn't know what exercise you've decided to choose. It really just cares that you're getting your heart rate elevated and your body just cares that it's moving. So, we kind of talk about, what excites them, what goals they may have and what tangible goals are actually realistic in a pandemic setting. In a non-pandemic world, I oftentimes encourage people to do group activities and with goal setting in mind, maybe that could be the motivational factor here. But from a virtual standpoint, I've definitely had patients, and I will use running as an example, or walking as an example, just because walking is kind of the easiest thing to do. It really just requires a decent pair of sneakers and your legs. And I'll say, you know what, you have your family members all on Zoom. Why don't you guys train for a specific distance or, pledge to walk a certain distance within a certain period of time. And those types of challenges and goal setting can be motivational. I think for other people, they're like, no, man, I hate running. I hate biking. Like, I really don't want to do those types of movements. And then you just kind of try to get to know the person and see what excites them. Is it dancing? Is it, lifting? Is it, what in it, what in the exercise movement is really kind of, provoking their creativity. And that can really just vary. But that's kind of how I counsel patients. I just try to find what makes them motivated and then what can sustain that motivation.
Yeah, I try to get my patients to realize that that same concept, because most people, when we tell them that, we want you to exercise more, they get very stuck in that, well, they only can think of going out for a run as exercise. Whereas when you don't even have to run, right? The guidelines of 150 minutes of moderate intensity exercise a week, moderate intensity is defined as a brisk walk. So we include gardening and things like that. Going out for just a brisk walk. You don't have to jog. You don't have to run a 5K for exercise. Anything that gets your heart rate up a little bit and a little sweaty and moving is going to gain you some benefit. But it takes some people a while sometimes to get over that classic entrained, I got to go get on the treadmill to get exercise. And that's a process that takes a while to unlearn for a lot of people, unfortunately.
And he brings up a good point. Yard work has become like the most common thing that a lot of my patients have been doing. Yeah. They've been like building walls in their garden, raking leaves and stuff like that. And I've, personally seen my parents when I go home, we mulch and they're like mulching for 5 hours. And I think they've also kind of seen the endurance benefits. So yeah, I think just daily tasks like that. Like I said, your heart doesn't care. It doesn't care what you're doing at all, as long as you're doing something.
That's a good rule of thumb, I think. And I believe I was doing quite a bit of gardening over the summer, so that counts. And that involved a lot of transporting soil from location A to location B. So I'm pretty happy that I got to do that.
Functional fitness.
Exactly.
Exactly. And I like what I think Dr. Singh brought up earlier about the motivation from social accountability and social groups, and how that is very possible to continue even in a virtual world. So that's another good thing to keep in mind. So now we're going to pivot a little bit and talk about exercise during a COVID-19 infection. So we want to ask both of you, what would your exercise recommendations for patients with COVID-19, whether they be symptomatic or asymptomatic, what might those recommendations look like? And are there any negative consequences to exercising during that time?
So yeah, that gets into a different area. So in general, our recommendations have always been, even in the pre-COVID area, that you don't exercise heavily during an active viral infection. The reason being is there's at least animal data that animals that were exercised intensely while they were actively infected with a viral infection had a much higher incidence of cardiac complications than those animals who did not exercise with the same viral infection. So we've recommended for a long time that you don't exercise heavily in the setting of an active viral infection. Most people are going, it's hard to get someone who's very, very active to stop. So my recommendations are generally, it's time to lay off the heavy stuff. If you want to go out for a walk and move and you feel up to that, that's okay. But let's back off. And if you just need to move for the sake of moving, move lightly. If you feel bad, it's probably time to take a complete stop until your viral infection has resolved. That's been the major concern now with COVID, is that if we're at a heightened level of concern that COVID could affect the heart anyway, then we really are much more diligent about pushing our athletic individuals or even our recreational athletes to really back off, if not stop, while they're actively infected. And that's whether you're symptomatic or not symptomatic, for the way I counsel my athletes and patients.
Mm-hmm.
Yeah, I say, I think the similar things, pre-COVID, I would probably say, and, probably using my personal experience as well, sometimes some people feel a little better when they're moving, particularly if they have kind of like the typical cold symptoms, no fevers, no real lethargy or kind of malaise. Sometimes just getting out there and being a little active, just promoting some airflow, some oxygenation makes you feel better. But with COVID, because there are so many unknowns, I'm a bit more conservative now. And, I would say the same thing. I think there's so much kind of stuff out there with respect to cardiovascular complication. And, with myocarditis, the big thing that we always worry about is sudden cardiac death, for however low that risk may be. And so, especially with COVID, I think because the data, whether it be autopsy data or not, is still kind of neither here nor there in my opinion. I would rather, be cautious and say, let's not make your heart angry, in layman's terms. Let's just back off. And in my heavy athletes, I usually say this is an opportunity for active recovery. Why not use this opportunity to just kind of let your body heal, let your muscles relax, and you'll be better for it. And then if you think about it that way, maybe that's kind of like a little bit of a psychological twister. I think it's more palatable.
Yeah, the term
So,
recovery for sure.
yeah. And I guess this whole notion that some people might think that they're sweating out whatever kind of infection their body has, that's not really a thing then, is it?
No,
No.
that'd be great though. Then I think everybody with COVID to
Yeah.
sweat it out.
Yeah, that would be quite the motivator to exercise for sure. And it sounds like then that there are similarities in terms of the recommendations to other viral infections, but taking a bit more of a conservative approach in terms of this one, since we have so many unknowns that remain.
Yeah, there's a lot of unknowns. So even in the guidelines that have been written for athletic individuals, it's taken a more conservative approach, based not on actual data from athletic individuals, but about circumstantial evidence until we understand and learn more. And hopefully we'll continue to understand and learn more that the glass half full of COVID and this virus is that it's the most studied virus probably ever known to man at this point in time. And it's only been in a short period of time. So hopefully it educates us in the future as well.
And we touched on some of the mechanisms, mainly an increase in blood flow. Are there any other mechanisms that you can potentially think of? Like, I remember there was this one article about some of the patients in China who engaged in yoga, and that was a way for them to actually start to clear their lungs a little bit. And it seemed to be a little bit more effective with clearing the lungs and stuff like that. So are there any other mechanisms that come to mind of potentially how exercise could be useful, low-grade exercise useful during an infection?
During any infection? I mean, so the circulatory system is essentially, in my mind, as a cardiologist, kind of like the end all be all, right? So I think it really does come down to vasodilatory effects, oxygenation, ventilation, and honestly circulation to your muscles, tissues, and organs. With regards to clearing the mucus or clearing whatnot, I think, deep breathing, right? Or you could relate that or correlate that to incentive spirometry in the hospital, right? So, taking deep breaths really opens up those air sacs, those alveoli in your lungs. And so that in itself can maybe help clear up some of that sputum production, kind of like similar to respiratory therapy, right? So in that regard, I think, yeah, sure, deep breathing exercises, deep inhalations and whatnot can help. With respect to COVID, I'm sure, there is incentive spirometry going on and whatnot. Is that an end all be all though? No, I think it's still kind of a supportive mechanism. But that's kind of, it's hard to identify like what else does exercise do with respect to the other systems, because it's still, at the end of the day, it comes down to circulation, lymphatic flow, and whatnot, and cellular health, right? So.
Yeah. Great minds think alike. I was exactly thinking about incentive spirometry when you said that as well, Tawana. So, I think the benefit of exercise is probably before you get sick. If you think about it as a sort of a sickness, wellness, fitness continuum, the farther you are on the fitness continuum, the more hedge you have against the sickness side of it. So, being fit before you get sick gives you some hedge against that sickness. Doesn't make you immune to any sickness. No, exercise doesn't make you immune to anything, but it certainly gives you a little bit of a hedge towards that.
So if you are a professional athlete, relying on that other extreme of fitness, and there have been many professional athletes who have been diagnosed with COVID-19 to date, what have the recommendations been for them for training while infected and as they return to physical activity?
So professional athletes are a different sort of cup of tea than recreational athletes, partly because they're dependent upon their professional athleticism for income, whereas recreational athletes aren't. They have tended to follow the same guidelines, meaning they have rested their athletes that have active COVID infection Because they're an investment by the teams and the organizations, they tend to have the resources and to do more testing. There's still not been a lot of cardiovascular disease and sequelae found in professional athletes that have had COVID. There have been a couple that have been in the media that I know of. I don't, because of their professional nature, that you're going to hear about them, but there's only been a couple. A lot of their goals have been to prevent the infection and isolate those that have come in close contact. So like, when the National Basketball Association did their bubble, they had no positive tests inside the bubble showing that they can do it. Whereas other leagues like Major League Baseball and the NFL didn't have a bubble, and they had some more positive tests, having to cancel some games and things like that. But they still haven't at least announced any major sequelae that they've found from it.
Yeah, I suppose it's going to be interesting to see what kind of bubble comes into play for the upcoming seasons of professional leagues and how that might play out.
And if we look at exercise after an infection, do we see that there's potentially any decrease in performance in some individuals who have been infected and return to play or return to training?
I think this is it's very interesting because it all kind of depends upon what their symptoms were like and what kind of symptoms in terms of severity, as well as the type in terms of system. So, Mike had alluded to the fact that there's, definitely some neurologic manifestations from COVID. And one of those that I've seen is kind of this, autonomic dysfunction with respect to really high heart rates and low exertion. And it's very hard to distinguish whether that's related to some neurologic sequelae or whether that's related to just pure deconditioning. Because, oftentimes we're telling athletes to really hang low for maybe about 10 days at least, maybe 10 to 14 days. And then if they require, seeing a specialist for evaluation prior to getting back to their sport at a university or from a professional level, that can also take some time away from their kind of getting back to exercise. And so, kind of for these individuals, I typically say, if you're feeling well, if your symptoms have completely resolved, and, I ask about cardiopulmonary symptoms, I usually say, let's get back to some sort of graded protocol, work with your athletic trainer on doing that. And then, we can kind of parcel out whether or not there's something unrelated to COVID going on, or whether there's something COVID related with regards to exercise. People who are hospitalized, who've required, supplemental oxygen, who have had, some sort of cardiac manifestation, those are individuals that I, am a little more conservative about. But at some point, we still have to get them back to the field or get them back to the court. And so it's kind of one of those things where you want to work with your athlete and say, let's start slow and build. One, to avoid musculoskeletal injury, right? Because they're already deconditioned and have some level of mobility. And then two, to see whether or not they develop any recurrent symptoms as they move forward. And then if they do, we obviously will look at them and evaluate them a little closer. That's kind of how I've been doing things.
Yeah, I think there's two things that we think about when we counsel our athletes or patients that are going back to exercise after they've had COVID-19. Most of these are mildly symptomatic and they're trying to just get back. But a lot of them, as we've just alluded to, we tell them to back off or stop working out while they're actively sick. And that may have been 10 or 14 days if they haven't worked out. So they're going to decondition some. That's going to vary from person to person. It's going to vary about, what degree of fitness you had to begin with, how much conditioning you lose. But you can't not work out or not exercise for 14 days and then think you can go right back into exercising like you did beforehand. No one's going to be able to do that. So take a reality check and make sure you got to scale back and start slow. And we get concerned about particularly our competitive athletes and our collegiate athletes who have now been out for 2 weeks and the team's been practicing for 2 weeks. And now that the coach tries to drop them back in as if they had never missed those 2 weeks. And they're going to struggle. And we don't want them to struggle. And we don't want them to think something's wrong when it may just be that they need to start slow and work back up to regain that conditioning. The other thing it allows us to do, because we are still worried about cardiac and pulmonary sequelae of this, is that graded return that Tamana brought up allows us to make sure that they're hitting benchmarks that we would expect them to hit as we return them to back to a level of play. So we can monitor for any sequelae that may have not been as obvious when they were resting, but now starts to come out as they exercise a little bit.
You know, the best way to do it also is sometimes I just tell my patients, just think about it as, you know, the unfortunate injury. And if you think about it that way, you know, if you pulled your hamstring or you got IT band syndrome, you're not going to immediately start running, right? You got to let yourself heal, and you got to build back slowly. And sometimes that kind of helps. I mean, it stinks either way, though.
For sure. But it seems like it's really very much about this graduated return to physical activity and to where they were before. And to be honest, that sounds very familiar because my background is in concussion research, and graduated returning to activity is very much promoted in there as well. So a broadly applicable approach. So
it's really important. And one of the things that we want to know then as physicians that are caring for people that are returning to play is if that return, that graduated return doesn't go like you expect it to go, you've been at it for a couple of weeks. In general, you can regain your fitness because you know yourself well in a couple of weeks and you just can't get there, then that's a reason to come see us, to investigate. Is it something else going on? Is this an actual diagnosis, sequela of a pulmonary problem or a cardiovascular problem? Or is there something else going on? You know, maybe these lingering symptoms of COVID that we keep hearing, the quote, long haulers of COVID are starting to become more prevalent and heard about these days. So trying to help them figure that out then is where we come into action, particularly if the return to play doesn't go like anticipated.
Yeah, and I think that's a pretty scary part of this disease is that there are such thing as these long haulers that might take longer to get where they were. And unfortunately, and I'm not too sure if this is the case, but may not get to where they once were, which obviously as an athlete is pretty difficult to sort of live with.
Yeah, I've definitely heard about a few athletes that have struggling for several months after their infection to get back to where they were and still aren't back to where they were. And some of them aren't able to even play their sport right now because they can't compete at the level that they need to compete at that level of sport, and they keep having to back off.
So it really does seem that this graduated return provides the opportunity to avoid injury returning too quickly, but also the opportunity for checkpoints to determine whether something more is happening. So that's very good to keep in mind. So we talked earlier a little bit about elite athletes or professional athletes, and we're wondering if there's any recommendations from the both of you for returning to physical activity for non-high performance athletes.
I would say it's honestly the same thing. I think, you know, exercise is relative, right? So for someone else, you know, that level of, it's really honestly like level of intensity or exercise dose that you're used to. But I would use the same kind of algorithm, you know, try to get back in slowly, use those checkpoints as you alluded to. And if you start to notice that, you know, you're not seeing any typical gains that you would expect when you do your kind of gradual protocol or your training cycle, and that's when you should really pick up the phone and talk to your physician and say, you know what, this is what's going on.
Yeah, the big difference between the professional athletes and I think our recreational athletes is the level of people hovering over the professional athletes and looking at every little nook and cranny of them, whereas that's not happening at the recreational athlete level. It doesn't necessarily need to happen at the recreational athlete level. You know, I think the general recommendations, if you were mildly symptomatic, without an actual true cardiac concerning symptom, then that gradual return and see how you do is a reasonable thing. If you had more moderate to severe symptoms or had cardiac symptoms at any point in time, you probably at least see a physician before you go back, particularly if you were like hospitalized and requiring supplemental O2. You got to be evaluated by a physician before you re-engage in heavy activity.
So then for people who do want to get back to exercise, or people that are exercising right now, do you think the policies are adequate in the gym setting currently? So for example, here in Toronto, I think we're allowing 10 people into a room at a time, yet people don't have to wear masks when they're exercising. So do you have any other recommendations on potentially what some of these gym facilities can do?
I think it's highly variable. I think some gyms have been really excellent about how they're using precautions. And I think it's also very dependent upon what type of exercise you're doing. If you're huffing and puffing and exuding all these respiratory droplets on a bike, on a treadmill, kind of doing really any cardio, there's greater risk for transmission, right? And so in that regard, you really should be masking up and socially distancing if you can, depending upon what the gym is able to do. If you're doing, kind of weightlifting, more low intensity, doesn't really require rapid respirations, you could argue that maybe the transmission, and this is speculation, right? You could argue that maybe transmission of respiratory droplets may not be as high. But I would still say, at least here, there's a number of gyms that are using kind of these viral sprays and cleaning, mandating masks. So, I think those precautions should definitely be primary. But if you have the opportunity, if you have a gym that wants to still do some form of group exercise in a socially distanced way, some gyms are doing those things outside in fresh air versus, being in a confined space. So, I would just say be, kind of really do your due diligence when you're thinking about going into a gym, and just, be cognizant of what type of exercise you're doing and who you're doing it next to.
Mm-hmm. Mm-hmm. And I think it'll be interesting, especially once the temperature drops more and it's a little bit more difficult to do those outdoor workouts. And I think that'll pose an interesting challenge. And the gym that I go to now, which is the UFT Athletic Center, they have a mask mandate in place now.
Yeah, my CrossFit gym, CrossFit CLE, I'll give them a little shout out here, mandated masks the entire time you're in the gym now. So you're huffing and puffing, doing a high intensity workout with a mask on. So it's about finding a mask that will work for that. And there are some that are better than others. But also, in addition to that, having some social distance. So, limiting the class size to your square footage is a good proactive measure by a gym anyway, and shows that they care about their members, which is a good quality gym, I think, to begin with, and highlights that, but still gets you to a little bit of that social interactions. Cleaning is important, but also realizing, from a programming standpoint that, bench pressing with someone spotting you and standing over you as you breathe heavily, within a couple of feet of them probably isn't the best sort of exercise to be doing right then.
Mm-hmm.
One could say exercising in the winter outside may be the most social distancing you can get. Just gotta buy yourself a good pair of shoes with some Gore-Tex.
Mm-hmm.
Yeah. And I personally love running outside in the cold. I don't know what it is, but it kind of feels pretty awesome when you just have the cold air rushing by you as you're running. I don't know. It's sounds
like a
fun
person
feeling.
from Canada.
Well, I mean, you build up some grit, right?
Mhm.
when you're like running a race and dying, it doesn't seem so bad.
Yeah. In a recent interview, both of you mentioned some recommendations for performing exercise safely, and you just recommended or described a few of those recommendations now, but can you expand on some of the things that, say, exercisers can focus on or look for if they're visiting gyms, or if they're trying to find other spaces and ways to stay active, especially, as we mentioned, as the temperature begins to drop?
Yeah, I think a lot of what we discussed, it's common sense stuff. Keeping that distance, that minimum 6 feet. If you're heavily exercising around a bunch of other people, it may be worthwhile to extend that distance, particularly if someone is already breathing heavily and ventilating heavily and they cough or sneeze. That cough or sneeze is going to go farther when they're heavily ventilating more. And there is some experimental data that suggests that that's a real thing. So you need to increase your distance. If you're outside, then, you need to increase that distance if you're out on the trail and someone's in front of you. And it's probably not the best idea to be drafting if you're a cyclist, for instance, to do drafting in this sort of an environment. Mask wearing as much as you can, and keeping things clean.
And what I will say, now that's very different from March is that, so many athletic companies are coming out with triple filter masks or breathable masks. And so, again, those masks necessarily haven't been, tested from a scientific standpoint. But I do think that they've probably been more vetted than the initial masks that we had. Maybe a little better than gaiters, though I still think gaiters are better than nothing. But I mean, there's a lot of stuff now on the market that you can get that may help, or at least make it easier to breathe.
Yeah,
Right.
that's the thing about exercising with a mask is, as you ventilate more and you inhale larger volumes, is that fabric ends up in your mouth. So there are some masks that are a little bit better structured so that you're not breathing them, sucking it into your mouth.
Right.
Because a lot of there's always a concern that you're over breathing carbon dioxide because it's hanging out in your mask, but no study has proven that. But what I think the studies are showing, either directly or indirectly, is that it's a different sensation, and that sensation gives you a feeling of claustrophobia. And it's really the mental aspect of wearing a mask that aggravates people, not the fact that you aren't moving enough air or that you can't move enough air. It's that you think you can't move enough air.
Yeah. And we actually recently did like a little face mask study here that showed that, it really didn't impact your functional capacity, or you could say your exercise capacity, wearing a mask. It's just like Mike said, it's really just that sensation. So
yeah, there's a big psychological component to mask wearing and your breathing that probably drives the sensation that a lot of people feel, rather than a pure physiological hypoxia or hypercarbia type effect.
Yeah, that's fascinating, because in the context of hockey, for example, I know a lot of my peers are wondering, what kind of mask they should wear under their actual mask with bars, because there's still lots of room for exchange of respiratory droplets. And actually, speaking of that context, in the context of hockey and other sports where you might be able to space out on, say, the ice or on the field, or whatever the context might be, but when we're in the locker room, and you're with everyone else, should some of the recommendations include spacing out, for example, maybe changing at home, or using more locker rooms in order to allow for spacing and that kind of thing?
I still think so. Yeah. I mean, I think you should be really socially distancing anywhere. I think with regards to viral transmission, it's still going to be more respiratory versus actual contact. But, if you have the space and the capacity, separate, or if you're going to go home, do it. I think with respect to contact sports, it's challenging because so many team sports at the colleges and from a professional standpoint, have contact. And I wish we could really test all those people who want to do contact sports, knowing that they're all kind of safe. We just unfortunately don't have that bandwidth.
All right.
Swapna, do you want to take this one?
Yeah, for sure. We've been talking a lot generally about exercise and health, but we wanted to bring it back to your own specialties. And as you both specialize in heart health, how has the pandemic affected cardiac rehab programs? And again, a little bit more generally, how has it affected inpatient and outpatient programming in general?
So with respect to cardiac rehab, similar to other programs nationwide, after the lockdown, we shut down our rehab programs, and then we mailed out our rehab centers, mailed out kind of rehab exercises that people could do at home. And then about 8 weeks later, they did reopen. Capacity is lower, but they are actually, kind of bustling. And with phase 2 rehab, it's still kind of on site. Phase 3 rehab is still much easier. You can do those types of things at home. It doesn't require, kind of the same protocol with respect to having safety measures in place. So I think the rehab centers are doing quite well. There are some patients who have opted out of rehab or have cut their rehab program short because of their concern with COVID. And for those individuals, we talk about what we can do at home. And, a lot of times what you're doing in rehab is essentially just, having supported exercise. And so if patients are confident in being able to do those things at home, it's a very easy transition. I'm not sure if Mike has anything else to say about the rehab specifically.
Yeah, the rehab facilities took a pretty big hit because they weren't offering anything in person because everything was locked down. What it did bring to the forefront was a lot of recent research about home-based cardiac rehab and the safety and efficacy of home-based cardiac rehab in select populations. And then how can we sort of pivot, and how can cardiac rehab centers pivot to offering more home-based cardiac rehab and support in that, and whether that's Zoom-based cardiac rehab or phone calls from the rehab specialist to help support them, because a lot of what's valuable about inpatient or in-house cardiac rehab is the emotional support that a lot of our post-cardiac patients have fear of starting to exercise again. Even though most of them are pretty safe, having that controlled environment where someone's there with them as they start to get back on a treadmill or do things is a big psychological impact. So I think this has garnered a bigger discussion about using technology for home-based cardiac rehab. Although I think we're still struggling to figure out how that's going to look.
Mm-hmm, mm-hmm. And this is obviously how this whole pandemic has kind of stress tested everything. And people now having to work at home a little bit more and tune in virtually, I think it kind of does sort of help to facilitate that growth in areas that we were possibly lagging behind in a little bit more before. So during this time, we've had audience members chime in with some questions, and we'll just turn over to those now. And so one of the questions that we have is, with the return from athletes, you mentioned a graduated approach. Is there any consistent observational or data being collected on them?
So yeah, there's quite a bit of effort to collect data on these athletes because there's been so much more of a impetus to do a little bit more screening before these athletes turn back. There's being a lot more data collected. So there's a national NCAA registry that is collecting all the imaging studies, or at least the reports and the incidence of cardiac involvement from the testing that's being done into a registry. And then one of the major conferences in the U.S., athletic conferences in the U.S., is doing their own registry in addition to that, with collecting a lot of imaging data to try to actually say something concrete about what's happening in our athletes with this virus.
Interesting. Yeah, and kind of going back to, as you said, this will be one of the most studied viruses that we've looked at in such a short period of time. And I think that information will be pretty valuable, especially with how we understand the other types of SARS viruses.
Absolutely. We do have other audience questions, so I will share the next one. You mentioned wearing masks in the gym, and companies developing those triple filter masks mentioned a bit how they hadn't been scientifically tested quite yet, and said it's useful to find a mask where you can breathe, but at what point does a mask become ineffective if you can breathe through it?
It depends upon, the actual, I guess you could call it, pore size of the mask with relation to the actual size of the virus particle. Mm-hmm. So, I haven't looked into which masks actually have, smaller pores. I guess I'm kind of losing my verbiage here. Smaller pores that are, smaller than the actual viral size or the virus particle size. Those would probably be obviously the best ones. So, mm-hmm. The surgical masks, unfortunately, their pores are actually a little larger than the viral particles. I would say do your digging. There may be studies out there that I'm just not aware of that have looked at specific athlete masks. And if you do find them, definitely ping us because it'd be really interesting to see those. But I wish I had a better answer for you. I'm not sure which ones would be the best. I've just honestly, looking for masks for myself, just come across masks that sound enticing and sound safer. But like I said, really have no scientific basis that I'm aware of.
Mm-hmm.
Yeah, outside of an N95 mask, which has to be fitted to your face and worn appropriately, which a lot of them in the community aren't being. There's not a lot of data that any one mask is better than another. There's some observational data in controlled environments that maybe some mask styles are better than other mask styles. I think from a pure standpoint, any kind of device that's covering your face is better than no device covering your face, because a lot of the masks is meant to reduce the risk of you transmitting it to someone else rather than it being transmitted to you through that mask. So anything that cuts down on your spittle and contained to yourself is going to help in some regard.
It sounds like it really does boil down to buyer beware. Do your research to make sure you are buying a mask that can help, because there are plenty of masks out there being marketed that may not be quite what we're looking for.
Or live up to the hype put forward by the manufacturer of that mask that theirs is the best. They probably don't have the data to say that.
Right. I was actually kind of surprised as to how easy it was to work out, even with a surgical mask, which obviously wasn't designed for exercising and wearing that. But it's like, if you needed a mask, a surgical mask, at least from when I used it, it seemed fine. And it didn't impact my ability to breathe as much as I thought it was going to, which I thought was interesting. There's also obviously other masks out there, such as I think Under Armour has made a mask that's designed for exercise. And now we're going to see more of those masks from other manufacturers as well. So just continuing on to the next question. It was mentioned that cardiac rehab sends exercise recommendations to patients at home. What exercises would you recommend to those with minor cardiac or respiratory symptoms?
You mean while infected or kind of getting over their infection? Is this related to COVID or in general?
I think this is in general.
So it's kind of what we alluded to already, kind of have to listen to your body. If you're having, kind of significant symptoms that like shortness of breath, for instance, or chest pressure, those are huge red flag symptoms where we would say you should really seek counsel from a physician before you really do any sort of exercise. If you're talking about maybe, a little bit of shortness of breath that really doesn't impair your ability to move or exert yourself, use your best judgment. Maybe that's an opportunity to just either lay low or to reduce the intensity of whatever exercise you're choosing to do. But I think the main take home here is we're not saying you should be exercising when you're feeling ill. We're saying that if you have some underlying symptoms that are mild, that you could otherwise go about your day with, and you're usually used to being active, you could try to do some activity, but at a lower intensity. But it's a judgment call that, really no provider can really provide a recommendation for unless they're seeing you and specifically talking about what you're doing and what you want to do.
Absolutely. And I think that wraps up our audience questions, taking a look at the time. That is perfect timing. So now we'll just take a moment to thank you both so much, both of our esteemed guests, Drs. Tamana Singh and Michael Emery, for all of your insights. And thank you also to you, our audience, for your questions that made for quite an engaging discussion. And if you'd like to continue the discussion, please head over to our website, medicineInMotionPodcast.ca/live, and check out our discussion forum.
And if you'd like to listen to this episode again or share it with your family or friends, you can find a recording of today's conversation in podcast form by searching Medicine in Motion on iTunes, Spotify, and Google Podcasts.
So thanks for tuning in. And as always, we love to hear what you think. Find us on Instagram, Facebook, and YouTube at Medicine in Motion Podcast, and connect, follow, like, and subscribe. Until next time, remember,
exercise is the best medicine. This episode of Medicine in Motion was made possible by the generous contributions provided by the Rising Youth Grant. Thank you very much, Dr. Singh and Dr. Michael Emery.
I enjoyed it.
Thank you. Thanks so much for having us.